Hi, everyone. Looks like everyone's trickling in. In the interest of time, we're going to go ahead and get started here. Okay, hello and welcome to UC San Diego. My name is Helen Nguyen, and I will be your moderator today. Thank you again for joining our webinar on health requirements for incoming student. This webinar is presented by Student Health Services Director of Nursing, Annie Horn, who will oversee the incoming requirement process for the university. The Student Health Services nursing team will be your point of contact for this process, and they are here to support you as you work through these health requirements. This PowerPoint will be posted on our website, and it will be dropped in the chat very soon if you wanted to take a look at our website. And many frequently asked questions will be answered throughout the presentation, but we will have a designated question and answer time at the end, and you can submit your questions via the Q&A function via Zoom down in the toolbar. Let us know if you have any questions as we go through. And then before I turn it over to Annie, there are a few things we wanted to go over. All right, hopefully everyone can see my screen now. Fantastic. And the first one is that we will, well, if you have your phone available and if you're not viewing this webinar on your phone, then I would encourage you to take it out and scan the QR code in order to download Willow. Willow is your all-in-one resource hub, whether you're looking for any campus events or academic support or even mental health resources, it's all available there. So the app meets you where you're at, and it will collect all of your interests and recommend services that are based on you. And best of all, it can even connect with your My Student Chart to view your upcoming requirements or upcoming appointments at Student Health Services. Right, and then let me introduce you to Student Health Services. Student Health Services is the medical branch of the Student Health and Wellbeing Cluster, and we provide primary care and urgent care services. For primary care appointment, you can schedule it online. For urgent care, you simply walk in and we'll see you based on your needs. We also have lab, pharmacy, optometry, social work, and x-ray available to you within our building. It's available to all undergrad, graduate, and professional students who are enrolled. And let me talk to you a little bit about how we can access these services. So insurance is always a biggie. So there is two options that we offer in-house, which is the student health insurance plan. It's called UC SHIP. You are automatically enrolled into UC SHIP unless you waive out. UC SHIP is a fantastic package. It includes medical, behavioral health, pharmacy, dental, and benefit, and vision care benefits all available to you. But if you choose to waive out of UC SHIP, RAFT is a great supplement to your insurance plan. You can receive care at Student Health for very low to no cost with the RAFT access fee. RAFT costs $75 per quarter and is automatically billed to your student account. And lastly, we are moving into our new home. We are currently located on Library Walk, right across from Target, but we are moving a little bit down the road. It's really not that far. But in this new building, we will be able to still provide you the same range of services that we have always been providing, but in a central location with our CAPS branch, our psychological services branch, within in-house too, so you don't have to travel to multiple different places. And with that said, I'm going to turn it over to Annie to get into the important part of this presentation.
Thank you so much, Helen, and welcome everybody. Thank you for joining and getting yourself informed at the beginning of this process, and congratulations on accepting a position at UC San Diego. We're thrilled that you're joining us. And as Helen said, I'm the Director of Nursing for Student Health, but I oversee this process for the university. Myself and our team, nursing team and medical assistant team have been doing this for a very long time. We're here to help you with this process. And firstly, I just want to talk a little bit about why we do it. And all of the UC schools have the identical requirements, and we're really wanting to hopefully prevent vaccine preventable communicable diseases, so outbreaks on campus, because they are extremely disruptive personally and academically. And we've definitely had our fair share of these. So we really work hard to ensure that everyone's immunity is good and our population's immunity is good. We're definitely seeing the re-emergence, sadly, both nationally and internationally of vaccine preventable diseases as herd immunity drops in some areas. We're definitely seeing measles cases, we've seen mumps and all sorts of things. And our tuberculosis requirement is really to prevent active cases of folk with TB coming onto campus. And we very occasionally this happens. It happens at a lot of universities, and so, but we put a lot of time and effort into preventing these things from occurring at any sort of frequency. So we're really here to protect you and the whole community. And what are our requirements? As mentioned, TB is one of our first and big ones, and every single incoming student, including those transitioning from undergrad to graduate school, if you're deferred or you're transferring, every single person is required to do tuberculosis screening. And those that are at slightly higher risk will also be required to submit testing to us. And then we have what we call our four core vaccine requirements. And these are all based around the fact that these illnesses are transmitted through the air, through droplets or respiratory aerosols. And so they're highly contagious in dorms and in lecture halls. And so we really put a lot of effort into reducing the incidence of this. Our first one is Tdap, and the component that's airborne in this is the pertussis, or commonly called whooping cough. The next one is measles, mumps, and rubella. The next one is varicella or chickenpox, and our final one is meningococcal, and it's the standard meningococcal vaccine, not the specialised Men's B vaccine. And as far as starting the process goes, absolutely everything that we have, as Helen mentioned and Lake kindly dropped in the chat, we have a website that has a page dedicated to this process. So if you've got a question, it's really a great place to visit first. And I'm going to show you that website just so that you have an idea of what we're talking about. So let me share my screen with you. Screen one, there we go. So this is the landing page of our website, and quite aside from incoming requirements, it has lots and lots of really, really good information on illnesses, how to book appointments, where to go for after hours care, how to sign up for my student chart. But the page that we're going to focus on today is health requirements for incoming students. So there's a popular link at the bottom of the landing page, or it's also under resources. So you can go to either spot, and this outlines all of what you need to do for this process. It gives a definition of what an incoming student is. It gives instructions around how to sign up for my student chart, which we will also take a look at very soon. It gives all of the deadlines and academic hold dates. So failing to take care of these requirements will mean that a hold is placed on your account, which will prevent enrollment in classes. So it's extremely important that this is attended to early. It has our forms. So if you are required to do TB testing, the form is on the website as well as in my student chart, which we'll take a look at soon. And then it has the immunisation form as well. These forms are really great to take to your healthcare provider because there's lots of guidance and information on those forms, and you can reference them about any parts of this process. I've listed out here all of the required vaccines, as well as common examples of names. You might want to use your own vaccine record instead of our form, and sometimes the brand name will be written rather than what the vaccine is, so this helps decipher that. There's some additional notes there if there's anything pertinent. And then we also have a list of strongly recommended vaccines. Now, these aren't part of the requirement, but they do form an important part of keeping yourself healthy. in your life and in your academic life. And we really urge, and if you have had these vaccines and can enter them in at this point, it's really useful, especially if you become patients of ours, or you might choose to do travel abroad programs, in which case we will need all of these additional vaccines as well, and it just saves you a little bit of time going forward. There's information here about the exemptions. There's all the forms in one place. There's links about what the policy is and where all of these requirements come from. There is information here for international extension students as well as professional school students. So if you are attending this webinar and you're from one of these specialised groups, you have some slightly different requirements, and you can find what those are there. There's information on questions here as well. So it's a really good resource for you to utilise. So I'm going to stop sharing now. So the next thing to start this process is activating My Student Chart. So Student Health Services, and actually all of UCSD Health, uses Epic, and you may have come across this in another health system. And the student-facing portal that you use, and what this whole process is initiated from, is called My Student Chart. And on our website, every single page has a link to get into there. So if you forget what it is, you can download it. Also, there's an app. You can access it on the web or through app. It does require that you have your UCSD student AD login, which is your UCSD email and password that you are given after you accept an offer of admission to UC San Diego. And if you are having any issues with that, getting an AD login, there is a link here on Blink that you can actually make an inquiry about if there's any delay in receiving your AD login. The portal, we have a special login for students. It's not using a username or password. It is actually using, as I mentioned, your student Active Directory login, and that will make sure it takes you to the correct place. And you will see both options on the sign up page, but please do use your student login. And now I'm going to give you a live demo of the My Chart, which is a test environment and a test patient. So I'm going to share my screen with you again, and here it is. So this looks just slightly different. Yours will say My Student Chart, but this is just a test environment, and you'll be using here a current UCS student login, but I'm going to just use this part for the purposes of demonstration. So going in, you land on, let me go back to the home page. You land on a page that looks like this. And there's all sorts of functionality in My Student Chart. You can see any booked appointments. You can book appointments online through here. You can send providers and nurses messages. There's billing information. There's your test results, your medication lists, and all sorts of really useful information. For the purposes of incoming requirements, we're going to go to the specific spots. Now, the first spot I want to show you is COVID-19. And why, even though COVID-19 is no longer a required vaccine, by going here first, if you have any vaccines that can come in through the California Immunization Registry, pressing update will pull not only COVID-19 vaccines in that you might have received, it will also pull in any other vaccines that you have in there, and it will save you just a little bit of time. So we recommend that you start with the screen just so that you can pull in vaccines you've had elsewhere, which is really useful. The next screen that I want to show you is on the menu, and it is called Immunization and Screening. And this is the main screen for this process. The first button will be TB screening, and you will push this and it will ask you a series of questions. Now you just answer those and the system will let you know if you need to do TB testing. If you do need to do TB testing, then you will be given a link to a form, and the form is also on our website that we just showed you, and then you will go and get your testing done by a healthcare provider, come back and upload the form to us, and we will review each and every form that comes through and either say that that's adequate and complete or request additional information or additional testing. So please get onto this as soon as you can. And then the second one is the immunizations. And so starting this process takes you to an online form. So you will have your vaccine record or our form that you and your doctor has filled out, and you will come and enter all of the dates in here. There's more boxes than vaccines needed, just in case people have had additional doses because they've needed boosters, etc. If you've received measles, mumps, and rubella as separate vaccines, there's space for that. There's space to add blood tests if you need to do that instead of providing dates of vaccines or you can't find them. And then there's all of the highly recommended vaccines too. And then right at the end, there's a box that you can upload your record, and then that comes through to the nursing team. So it's a very straightforward process, generally speaking. If it's not a straightforward process for you, go back to the menu and go to Student Health Ask a Nurse. This is a customized page that comes through to the nursing team that are working on this process, and you can ask us any questions and we will help you. This is also a resource going forward for when you're a student, whether you have our insurance or not. This is a place that you can come and ask questions of the nursing team about any aspect of healthcare. So this is a really great place to remember, and you can use this at any time. So those are all of the spots I want to show you for this demonstration. It's very important to go ahead and activate my student chart because I will send everybody reminders on a frequent basis. So as long as you've logged in once, it allows me to send you messages. So really good to go ahead and do that. So first of all, I'm just going to go a little bit deeper into the TB requirement. And that's always first because the deadline and the holds are placed first. And that is simply because we are really actively trying to prevent anyone with actual TB, active TB, from coming onto campus. So we're actually preventing, actual illness. Whereas with the vaccines, it's about prevention. So this is about screening and testing. If you are required to do testing, we accept TB skin tests. We accept quantiferon blood tests, or sometimes called T-spot or IGRA blood tests, or a chest X-ray. The student health nursing team will review those submissions, and we will send you messages. We will send you a message saying you're good or we need more. So please make sure you check back on those messages, and please get onto this as soon as you can. Occasionally people need to do more testing, and so it's really important that you allow yourself plenty of time and also time to get an appointment with a healthcare provider to have this done. Next, we'll take a look at the immunisation requirement. So the deadline is July 15th. We want you to put as much in as you possibly can by that time, but we don't place holds until partway through the fall quarter. And we do that to allow you time to get any missing vaccines that are not available in your countries that you're coming from, or perhaps you don't currently have adequate insurance coverage. And so we give you that time to be able to come to us or come to wherever your designated insurance is in San Diego to get those caught up. We need you to get all your vaccine records, and that's best done well before you come to school. You can use our form to guide you or use your own records. Your healthcare provider is a great source of information. They will have hopefully your past records of vaccine shots, and if you're missing anything, they may recommend and order blood tests and titers. And please submit even if you are incomplete, and just get as much in as you can, and then you can communicate with us if you have updated doses. Just to look a little bit more at the vaccines, the first one is Tdap, and mostly you would have had that around 10th or 11th birthday. DTaP or TD doesn't meet the requirement because we really need you to have had that pertussis, adult pertussis component of Tdap. The next vaccines are MMR and varicella. These are both live vaccines and usually have been given when you were young. In the US, it's usually given around the first birthday and then around the fourth birthday. It needs to be on or after the first birthday. Given any younger, maternal antibodies can actually reduce the immune response to the vaccine. So if it was given before you turned 1, you will need another dose or a blood test. The two vaccines need to be at least 28 days apart. It doesn't matter if it's a lot more, but it can't be any less than that. The vaccines need to either have been given on the same day or 28 days apart. If you got single vaccines, you need 2 doses of measles and mumps and 1 of rubella to meet the requirement. And if you can't find records for these 2 vaccines, or you had the disease, your mum says you actually had chickenpox, then you will need to show us a blood test that you have immunity against these diseases. And that is a useful alternative. And then the last requirement is meningococcal, which is the ACWY vaccine. It's for students under the age of 22. It is highly recommended up until 23, but it's not required after the age of 22. The dose needs to be on or after your 16th birthday because we know it lasts approximately 5 years in terms of immunity. So it might be that you received that dose when you were 14, so you may need to get an updated dose. Brand names in the US include Menactra, Menveo, Med-Quad-Fi, and there's a couple of others now too. And it doesn't include the meningococcal B vaccine. It just is the standard meningococcal vaccine. Just the exemptions, there is, if you have a medical contraindication to receiving a vaccine, you may apply for that. Maybe you've had a past reaction or an allergy to a component of the vaccine, you will get your healthcare provider to fill out this form and give us some information, upload it to the nursing team through Ask a Nurse, and we have a small group of us that review those, and then I will be communicating with you about whether that is approved or not. Same goes for religious exemption that is available. For both of these, if the exemption includes an MMR or varicella, I will ask you to get a blood test to see if you do have some immunity, even if you may not have had the vaccine before. You may have had the illness or exposure to these diseases. And if we know that you have had a titer and it's positive or it's negative, if we do happen to have cases of these illnesses on campus, we can very quickly advise you as to what you need to do in terms of keeping yourself safe and healthy. And then we have some seasonal vaccines that are highly recommended to help prevent respiratory illness or the severity of those illnesses, and they include influenza and COVID-19. Living and studying on campuses means that you are exposed to a lot of different respiratory illnesses, so whatever you can prevent is really useful. These vaccines are available in the fall in the US, and we have updated doses, generally speaking, every fall, and we have these available at Student Health in a fast track clinic, so you can make a quick appointment and come and see us and get that done, or retail pharmacies have them, or your own healthcare providers. So there's lots of options, and we really do encourage and urge students, and many people do get those vaccines. So now I just want to cover a few frequently asked questions. We often get questions about where can I find my vaccine records. The types of places to check is your existing healthcare providers, your electronic medical record, past schools, your high school, early childhood records. Those are all the types of places, and mum and dad are often the best source of knowing where you might locate those. If you can't locate any of your records, then the options are to get blood tests for measles, mumps, rubella, and varicella, and then get an updated dose of Tdap and meningococcal. Tdap and meningococcal you cannot test immunity for, so you would need to get repeated doses of those if you can't find any record of them. Some of the vaccines are not available to everybody. So yes, you can get them when you come to campus. We have all of these vaccines by appointment. In both our nurses clinic and our fast track vaccine clinic, there is no charge for any of these vaccines with UC Ship, and mostly all insurance coverages, actually all insurance coverages are required to cover these under preventative health in the US. As I said, retail pharmacies in the US also provide vaccinations. And we have clinics running every day all through the academic year to obtain any of these vaccines and vaccines that aren't recommended as well, like HPV. Other questions include, for TB, we get a lot of questions that folk have had the BCG or TB vaccine as a child to protect against TB, and do they still need to do testing? And the answer to that is yes. It doesn't provide lifetime immunity, and it normally means that you have or are residing in a country with a higher risk. If you are coming to us from a country outside of the US, chances are you will need to do TB testing. If your skin test was positive, or your quantiferon was positive, you will need to return to your healthcare provider and get a chest X-ray to ensure that you don't have active TB. And that information is extremely important. So you would submit all the testing, and we would likely follow up with you through the fall as well if you did get a positive skin or blood test. And we would recommend other things that you do while you're at the university. If your records are not in English, please have them translated. It doesn't have to be formal translation, but we do need to be able to read those. Your religious belief excludes vaccines, yes, but please use our form. If you have an allergy or any reactions to vaccines, you can be medically exempted. Now, this can be a permanent exemption or a temporary exemption. Say you were receiving treatment for a condition that was going to be finishing, your healthcare provider might say after January 27, this person can receive the vaccine. So in that case, we would do a temporary exclusion. So just to recap, TB, everyone has to do the TB risk assessment, and then if you are instructed by the system to do testing, the deadline is July 15th. Holds are placed at the end of the month, and those holds for failing to take care of both pieces if needed will prevent enrolment in full classes, and we know those full classes fill up fast, so you really want to make sure that that doesn't happen. But if you do get a hold on, once we receive your testing or you do your risk assessment, and that's all that's needed, that hold will be lifted within 24 hours. If it's urgent, for example, it's around the time that you're needing to enroll in classes, then we can arrange immediate lift of those holds. So all is not lost even if you get a hold, but please try and prevent it. The volume of messaging and help needed around the deadline and the hold dates is very high. So as much as we can reduce you needing to reach out and struggling at that time, the better. So get started on this process as soon as you can. Immunisations, submit as many vaccines as you can before you come to campus, then get any missing vaccines once you're during that early part of the fall quarter. Nurses Clinic, we have self-scheduling for all of our vaccines, and so students start booking. You can start booking those about a month out. They open up and you can just schedule yourself a time. Everything should be submitted by November 7th, and then we do place holds on at that time for people that haven't got fully complete, and that will prevent enrolment in winter classes. So it'll be for the next quarter. So you don't want to have that happen either. But I will be sending lots of reminders, so make sure you just check any messages, and I'll be sending out timely reminders of when these things are due. How to get help, the best way really is sending us a message and ask a nurse. Make sure you read the messages from us. If you're having technical difficulties, there is a website here. Please don't include any medical information through email because it's not a secure way of transmitting that, but we can help you if you are having technical issues. Everything is on our website, and many of the questions that you have can be answered by going there first. And please just complete as many requirements as you can to avoid enrolment holds. Now, this is the team of nurses. They're all very friendly, and they've been doing it for a very long time, a lot of them. And so this is just the core nursing team, and there are many others, and there are many other medical assistants that assist us with the immunisations. The nurses will be helping exclusively with the TB, and so these folks are there to help you and support you along in this journey. So we are available. We have people answering messages, not 24/7, but definitely through US times, as in office hours, Monday to Friday, but then also in the evenings, there are nurses responding, and also weekends and holidays. And so, and some nurses may be on other time zones as well. So just send those messages whenever and expect to get a response within 24, 48 hours, except around deadline and hold dates, which sometimes we can't get through the volume that are coming in. I did want to just draw your attention to once you are a student, we have a dedicated line that comes through to the nursing team and that you can talk to about where to go for care. You don't have to have our insurance. This is open to all students. This is open to your families too, if they are concerned about you. That we can provide all sorts of information and direct you for care. This is available 24/7, 365 days a year. When it's not our direct team, it is an after hours nursing service that we have helping us. So we can help save you unnecessary costs by directing you to the most appropriate level of care as per what is going on for you. And if you've injured yourself or anything, we can help provide you with advice on how to care for yourself or where to go for care should that be needed. Thank you so much. And now we're going to open it up and answer all of your questions.
All right. Again, if you have any questions, please drop it into the question and answer function of Zoom. We'll go through them one by one. I will read them out loud and Annie will be answering them for you. Okay, the first question is, I am enrolled in a single summer session, one course to finish my degree. After a 37-year absence, is it accurate that I just need to get a titer to confirm my MMR and varicella immunity?
Yes, that does sound right. Yes. Mm-hmm.
For the COVID-19 declination, are there any practical implication I should know about in regards to like housing, in-person classes, campus access, or is it genuinely a no penalty opt-out?
It isn't even required that you opt out of it now, that all of that has been lifted up off COVID-19. So it's now a highly recommended but optional. You don't even have to opt out, and it has no bearing on any of the things that you mentioned.
Is the TB test Mantox test acceptable?
Yeah, the Mantoux test is another name for the tuberculin PPD skin test. Yes, it is acceptable.
In order to submit the immunization history document, is it possible to fulfill this via the yellow immunization record card?
Yes, it is. Yes, those are very good and generally speaking, very clear records of vaccines. So you are welcome to submit it that using that record.
Okay. Um, is I think I think the student is talking about the nurse advice
Mhm.
line. Is that hotline also for mental health issues or is it strictly for physical one?
It can be for either. We do have a CAPS, which stands for Counselling and Psychological Services, that is dedicated to mental health issues. But if your first port of call is through the nurse line, that is totally fine, and we can help link you to the most appropriate service or resource.
Where can we do TB tests with insurance coverage?
If you mean in the community, TB testing would be done through your primary care or your doctor's office or wherever you receive care. The other options, and I'm assuming here we're talking US because I don't necessarily have these options for other countries, but places like CVS Minute Clinic, they will also help order TB testing. Hospitals, clinics, wherever you receive regular health care will be able to either do it or tell you where to go for TB testing.
When is the deadline to submit the religious exemption form for vaccine and immunization requirement?
It's the same as the immunisation deadline, so as soon as possible, but absolutely needs to be done before holds go on in November.
Could you please share the link for where we upload our immunization records to?
Yeah, Blake might do that for us. It's my student chart.
And then I was wondering which services would be available to us if we waived UC SHIP and enrolled in RAFT instead.
Um, you can find all that information on our website. However, all of our in-house visits and most of our any of our in-house testing and lab, etc., it is covered, and it does cover, many things like TB testing and titer testing. Now, it doesn't cover at this time, it doesn't cover vaccines, but we can let you know what vaccines you might need and where to get them. And it doesn't cover prescriptions. So we would send any needs for prescriptions to a pharmacy that is covered by your insurance. But it's such a good deal. All you need is one visit to us and it's paid off the $75. I think it's a really convenient and very low cost, valuable option for students if you are choosing to use an outside insurance coverage.
And I dropped the link to more information on RAFT in the chat if you wanted to open it up and learn more about what is RAFT cover and what does not cover. Okay, I was late to answer my question, but my question is, can I take all the shots before coming to campus?
You certainly can. That's the ideal really, is that you get everything done before coming and then you don't have to worry about any of these.
If you have a California private insurance and opt out, can you still use the health center if you're sick or need a blood test?
Yes, as a student, you are eligible to use any of our services. There are parts of our cluster that there is no charge for, but I would say we are starting to bill some outside insurance companies, but not all. And that is why it can be very, very useful to have RAFT, so that if you do need to visit us, because we are super convenient, very student focused, that you do have opted into the RAFT option.
If I can't find my vaccination records, would it be a problem if I get the same vaccines again?
No. So, like I mentioned in my talk, you can get a blood test to see if you have any immunity to MMR and varicella. And then the only two left would be Tdap, and that's a vaccine that is boosted every 5 to 10 years anyway. So if you get an extra one, it doesn't matter. And meningococcal is the same. It is usually needing to be boosted before school anyway. So it doesn't matter. And even if you do get vaccines, sooner than you need, it just reignites your immune system, basically. It just sets those antibodies off again. And so there is no harm. And in that case, that you're describing, it is a useful thing to do, obviously.
I completed a TB test and got negative this January from my previous college. Currently, I'm out of the country and will not be back until after July 15th. Will I be required to take another TB test in this case? And if so, what happens if I couldn't take TB tests before July 15th?
So that's a great question. So TB testing it needs to be within the year of you coming in. So if you're coming in the fall, which most of you are, it needs to be since September 2025 to September 2026. So if you had one in January, that's likely to meet our requirement. Depending on where you're traveling, it is also recommended that you get TB tested 2 to 3 months after returning from a foreign country. That way you can just make sure you haven't had an exposure in that time. But as far as the requirement goes, that testing will be, if you're talking January 2026, then that will be within the time frame that we would accept.
Where in my student chart platform do I access the TB questionnaire?
You would go to menu and then you would go to immunizations and screening, and that's where the questionnaire is. For some reason, if it's not showing up for you, make sure you've gone into my student chart as a student and not as a patient in Epic. That's one thing to check. And the second thing to check would, if you were a previous student, your TB questionnaire may need resetting. And so send us a message in Ask a Nurse and we can reset that for you.
Then there is a question regarding, can you repeat the windows for the requirement? Let me go ahead and share my screen and Annie can talk through that slide again.
Thank you.
Here are the deadlines and enrollment holds for the requirements.
Lovely. So yes, TB, the deadline is July 15th. And we say July 15th, so we've got time to process the testing if that is needed for submission before the holds are placed on July 29th. So that is the window, but again, please do it as soon as you possibly can. For immunizations, we want you to get as many as you can before coming to school and then finish submitting everything by November 17th, when holds will be placed during the full quarter preventing winter enrolment. Thanks, Helen.
All right. And then where in the My Student Chart platform do I access the TB questionnaire?
We go to immunization and screening, and it's in there.
I'm already 30 years old. Can you confirm that I don't need to get the ACWY meningococcal vaccine? I only got the one for type C back then.
Yeah, no, you're not required to receive one if you're 30 years old.
How long does it take for a doctor's visit to upload into my chart data? If I see my previous health data on the platform, do I still need to upload an immunization requirement form for new vaccines?
Um, if you had some missing, then you would need to. If your requirement is already met because you've got other records coming into my chart, you won't need to, but you will need to message us just to make sure that we are pulling all of those vaccines in and making sure they're all and updating your compliance. Sometimes students make the assumption that we know that you've had vaccines, but we don't unless we go into your chart and reconcile those vaccine records from your existing healthcare system or provider, whether it be within UCSD or Epic anywhere in the US. So please just send us a message and we can make sure everything gets updated. If there's anything missing, we can let you know at that point as well.
Should we already have access to my student chart, or do we need to wait for access as an incoming fall student?
No, if you have been, if you've accepted a position at the university, and we have uploaded your details into Epic, my student chart is there ready and waiting for you to activate it by logging in just one time. So it's not like when you're a patient in a different health system where you actually have to get a setup code and activate it that way. We set them all up for everybody and you just need to go in and activate it. So you should do that before coming in the fall. If you've only very recently accepted a position at the university, like within the last couple of weeks, there might be a delay, but that's only going to be a matter of time. We upload new students every week into our system from the university. So sometimes there's a slight delay if you were a later acceptance or you were pulled in off the wait list. That's the other time that there might be a little delay.
I will drop some resources regarding my student chart here in the chat. And the PDF link. One moment. There you go. Okay, how can I edit my immunization history if I get a required vaccine after July deadline?
I'm assuming that you mean you've already submitted some and then you get another one. You would need to communicate with us. I'll be sending, there's a couple of options. You can send an Ask a Nurse message and a reply from one of us will allow you to upload to that reply. Or if I've sent a reminder message about anything, you can upload upload a document in a reply to that reminder, and we will enter that in for you. You can only submit one time. So if you got everything except for one vaccine, you will need to communicate directly with us to get that missing vaccine in your chart.
Is a HCP stamped immunization form sufficient for, or is it required to provide any proof of the required vaccine? If so, is there any particular format for the same?
So HCP is usually means healthcare professionals, and it uh, a stamped immunization form, you can do either. So an official immunization form or a printout from your existing EPIC or anything like that is also accepted. If you do use our form, we do ask that it is signed from a healthcare provider, and that healthcare provider's signature is saying, we have verified that this person has received all these vaccines. So you don't need to provide us proof on top of that. So just one or the other is totally fine.
If I do waive UC ship because I have private insurance with UCSD, can I still use student health services?
You can, as an HMO, it is unlikely that we will be able to bill that insurance. Um, but that would be where I would recommend Raft, and then you can use us for all of our in-house um, services, and then we can send you to outside other things like pharmacies, etc. If we don't bill your insurance. But yes, you can still use us.
On my student chart overdue list, MMR is listed twice. Should I just ignore one of them?
Yeah, you can. I'm not sure why it would be listed twice. Um, yeah, yes, you can go ahead and ignore one of them.
What does immunosuppression mean?
It means if you have a condition or a drug or a treatment that you are currently have or are taking um, that might suppress your ability to fight off infection. So there are many drugs on the market that people take for Crohn's disease, cancer treatments, all sorts of rheumatoid arthritis, all sorts of conditions that actually suppresses your immune function, and so you're more likely to get infection. That's what immunosuppression means. It also means that you're more likely to convert to an active tuberculosis situation. So, yeah, that's why we ask about that.
Well, there are, oh, okay. If I did my TB form and didn't receive any further information, should I not book a test?
That's correct. If you did your TB risk screening questionnaire and answered all the questions correctly, and it didn't prompt you to go for TB testing, that is the end of the TB requirement for you. Now, if you come from outside of the US and you didn't get triggered to do more testing, it might be that you answered a question incorrectly. So you can just send us a message and we can talk you through that situation.
Okay. Does student athlete at UCSD get additional services?
Um, I know that there are additional services associated with it, outside of us, with the actual athletic department. And then we do have sports medicine here at Student Health. But yeah, you might need to talk to your program a little bit more in depth about what information you need in regards to that.
For the hepatitis B vaccine adjudicated for adults 18 years or older listed on the form, I am not currently 18 years and won't be until after the deadline should I schedule to get this vaccine.
So hepatitis B is not required. It is a highly recommended vaccine. There are two types of Hep B vaccines on the market. If you've never had Hep B vaccine, I would strongly urge you to get it. It is a blood-borne illness, and it's very important to have protection from it. The one that you mentioned, the hepatitis B adjunctivated vaccine, is only for those 18 and over. It's a 2-dose vaccine. The regular type is a 3-dose vaccine, so that's why there's those two things listed. If you've already had vaccination for Hep B, you don't need to worry.
Can you repeat the information about the alternative to UC Ship? Yes, it is called
Mhm.
a raft, and I have dropped the link in the chat for everyone. Any other notes on raft, Annie?
No, just that it's a really fantastic option.
Yes, it is. It is $75 per quarter, and if you even visit us one time, it will be worth your money, essentially.
Yeah. And apparently that you can pay for it at time of needing care now too. So that's a good option.
Since I will be staying in grad school housing, can my son make use of the services for some urgent situation via his insurance?
No, we only care for current active students, but there is a urgent care very close to campus that's run by UC San Diego Health, and they accept outside insurances, so that would be the best option. And that information on that urgent care is also on the student health website. So if you look at after our services, you'll be able to find details for that option.
On my vaccine record for my IPV has 5 dates, but the form only has 4 dates. Should I go in chronological order and not record my most recent dose or not record my first dose?
That is the injectable polio vaccine, and just don't include the first dose because it's the last doses that matter. So put in your most recent 4 of the 5. It's a good question.
Okay. Um, for what concerns insurance, if I don't have a private one, what should I do to get the UCSD one? Is there any actions required from my side?
If you don't waive out, you automatically will have it, I believe. Helen, is that correct?
That is correct. You are automatically enrolled into the UC SHIP, which is the Student Health Insurance Plan. If you do want to waive out, be sure to read really carefully. And then if you want to opt into RAFT, because you want to waive out of UC SHIP. RAFT is often the very last question on that questionnaire, so just read the insurance information really carefully if you wanted to waive out or if you wanted to have RAFT.
Thank you, Helen. And I do believe insurance does a series of webinars too, or they definitely are also available to chat one-on-one by Zoom. So go to our website. They usually, hopefully, will have details there, or there's an email address. If you want more in-depth information on insurance, I'd highly recommend you do that.
If my last TB test was more than 10 years ago and I will be out of the country over the summer, can I take another test the day after I come back from my vacation, or do I need to wait a certain number of days before taking it?
For the purposes of requirements, you should take it before the holds go on.
Looks like there are no more questions as of now. Um,
It's wonderful.
Looks okay. One more just come in.
Mhm.
We will continue to answer questions until 11 a.m. So please feel free to add in anything that you have questions or concerns about. Okay, can I confirm that I've already completed the other 3 required vaccination and only the varicella vaccine is still pending? In that case, would it be acceptable as long as I complete the varicella vaccination by November 7th? In other words, there would be no disadvantage or issue as long as I complete the vaccination requirement by November 7th. Is that correct?
That is correct, yes. Wonderful, great questions, and this is a really good opportunity to ask us anything, and you can be rest assured that the rest of other people have similar questions, so you're helping everybody by asking the things you need to know.
While we wait to see if there are any other questions trickling in, just another plug for the nurse advice line. Just remember that we are available to you 24/7. If you, I don't know, get injured playing pickleball at 9 p.m. at night, please feel free to call that number. There will be someone on the other line helping you seek care. The emergency room is not always the best place to go. You're going to have to wait a long time for a very small issue. So call that number and they'll tell you exactly where you need to go, whether it is another urgent care or ice and wait until the morning, etc. And again, I have dropped that phone line into the chat if you wanted to save it to your phone. Okay, a few more questions came in. Hello. For the inactivated polio vaccine 4-dose series, does one dose of the IPV and 3 doses of the OPV satisfy the 4-dose requirement?
It does, but I will say polio is not required, but what you're describing satisfies adequate immunity.
I I'm from out of state and I have coverage from my parents. Should I accept UC ship or waive it?
I would talk to insurance about that.
Yes, this is a good question to talk to our insurance team about. Let me go ahead and drop in that email for insurance. Okay. You should be able to see it there. And then I only have two MMR live vaccine dates on my record. The immunization screening field has 3 dates. Do I need another one?
No, we have more fields than vaccines needed. Sometimes people need to get boosters because their first dose was before the age of 1. So that's why there are more fields. But if your 2 doses meets all of the kind of rules of vaccination, you don't need a third dose.
If I have a prescribed medication, how do I transfer that medication to campus?
It looks like maybe
It looks
late.
like it was already answered.
Yeah.
So if you are the one that asked that question, please check the answer in your Zoom function. So for TB test, do we need to take it until 7/15/2026 and hold it? And hold is still 7/29. So if we fail to do the TB test till 7/29, we get a disadvantage. Is that correct?
If it's on or after the 29th, if you submit it between the 15th and the 29th, I can't guarantee that it's going to be processed in time to avoid a hold, but we will process it in the order that we receive them. And even if you did get a hold placed, we would lift it as soon as we've processed that test. So that's why we set that deadline to give the nursing team time to process all of the testing that comes in around that time. But if you can get it in earlier, that's really better.
Okay, looks like it is time. It's that time. We're going to go ahead and start wrapping up. Any important takeaway you want to share with the group, Annie?
Really just get started as soon as you can. And if you've got questions, feel free to reach out to us because we're here to help you with this process. So thank you so much for attending. We really appreciate the opportunity to give you this information.
Thank you again, everyone, for attending. And please remember to log into your My Student Chart. It is a place for you to ask our nursing team all of the questions that you've asked here. There is always someone at the other end of the line answering your very specific case. And our website is available for all those deadline questions you may have. Thank you again, and we will be posting the presentation on our website. Have a good rest of your day.
Thank you.